Good evening and happy Memorial Day. I hope you're having a wonderful day wherever you are. And I want to take the time to send out a salute to the many men and women in uniform, especially the ones who paid the ultimate price, and to their loved ones, the family members who've lost someone in the military. It is a very special time of the year that we celebrate those who paid the ultimate price for all of us to have the freedoms and the things to do that the freedom and luxury of doing the things that we have to do in a free society. So again, a salute to all of you, and my thoughts and prayers are with the family members who are mourning loved ones that they've lost, whom they may be remembering. I hope you've had a great weekend. Tonight we have a great show for you. May not be quite as long. We're going to be talking about the health benefits of hyperbaric oxygen therapy. It's something that I have familiarity with in the allopathic side of my clinical practice. Certainly historically, I've referred patients for this treatment. And we're going to talk about some of the details of how it works. What is it? How it works, and how it may benefit you or one of your loved ones. So sit back and get comfortable, and I think we have a great show for you tonight as usual. Hello again. We're back, and as I said, we're going to be talking about the benefits of hyperbaric oxygen therapy. And before I get into that, I'm going to bring in one of my colleagues, Dr. Celeste Palmer. Hello, Dr. Palmer. How are you doing today?
Good.
So, hyperbaric oxygen therapy. Do y'all use that much in pediatrics?
No.
Not. Yeah, we have some experience. Hello, Bradley Thomas and Nicole Jones. I recall in my training, I was in the ICU as an upper level resident, and we were dealing with a patient who was admitted after smoke inhalation, and apparently he was on a fire, and then firemen had arrived, and so he was. I believe he was intubated in the field. I can't remember. We eventually had him intubated in the ICU. And so he was getting 100% oxygen, via endotracheal tube. And so I knew that he needed 100% oxygen. It was pressurized, so I thought by intubation he had pressurized oxygen. But the next morning, my attending chewed me out because I didn't refer him to hyperbaric oxygen therapy. So he was supposed to have gone to the chamber and that type of thing. And I think we eventually did put him in the hyperbaric oxygen chamber. So that was one of my early experience with hyperbaric oxygen therapy. So, and we've referred patients with diabetic wounds and the like. So what I want to do is go through some of the health benefits, talk about how it works. Many of our members in the audience may be aware of the fact that there are a lot of health spas and healing centers that use hyperbaric oxygen therapy. And so there's, a considerable amount of data there, but I looked at some of the data, and we'll discuss, what data is there, what's generally used, and how we can interpret that. And so I think hopefully this will be enlightening to, everyone listening to understand, what hyperbaric oxygen therapy is and how it might be beneficial. So first and foremost, what is hyperbaric oxygen therapy? Well, if you look at the word hyperbaric and then oxygen, so the phrase hyperbaric oxygen, hyper is increased, baric, if you kind of understand root words, is a barometric pressure or high pressure. So high barometric pressure oxygen. So you can just from the phrase hyperbaric oxygen, can imagine that, it's oxygen delivered at an increased pressure. So you have oxygen here plus increased pressure that's breathed in or inhaled. So it's thought to have advanced healing power. So in essence, hyperbaric oxygen therapy, it involves high oxygen concentration, typically 100%. Doesn't have to, but typically 100% oxygen paired with increased atmospheric pressure. Under normal conditions, the plasma, normally our red blood cells, the hemoglobin, our red blood cells carry the oxygen. And so the red cells only can go so far. But with hyperbaric oxygen therapy, you get this high concentration of oxygen and the high pressure. And so it's forced into the tissues, forced into the blood. And so oxygen is not only carried in the red blood cells, but it's also carried in the plasma, which isn't normally the case. So you have that situation. Excuse me. And so that allows the oxygen to be delivered at places beyond where it normally is delivered. So, you have a much larger concentration of oxygen within the blood. It's within the red blood cells, which is usually, maximally saturated, but now it's increased in the fluid level of the plasma. And so they estimate about 1,200% higher oxygen concentration that's delivered at tissue level. So you get a much higher concentration of oxygen when you have increased atmospheric pressure and increased oxygen concentration delivered. So by definition, the mechanism is a high amount of oxygen delivered at a high pressure. You're sort of forcing it into the tissues, and you get more of the oxygen where it needs to go. So the basics, 21% is what we normally breathe. So if you increase that to 100%, so that's a higher concentration, and then you increase the pressure, it has healing effects at the cellular level. So it gets into the tissue at a much greater concentration and to a much greater extent. Hyperbaric, as I said before, gas at a pressure greater than normal. Again, it's the concentration that's increased and the pressure that's increased that allows you to have the higher percentage of oxygen. Vegetables, hello, I'm Deborah Payne, good evening. And so you breathe that in. Treatments typically last about 60 to 90 minutes. And during these treatments, and I think we both have been into one of the chambers in a spa, but 60 to 90 minutes. You can watch TV or, work on your laptop or something. Pretty comfortable situations there. So what are some of the benefits? Well, it enables more oxygen to be delivered to the deep tissues. And so Janelle Williams, is this a service Montgomery Heart and Wellness will offer? That's a great question. Let's put a pin in that. Help me remember that. Dr. Palmer will come back. I want to come back to that question later. Okay. And so, but it gets into deep tissues, cerebrospinal fluid, and the brain, spinal cord. And that's important to remember when we talk about some of the health conditions that are effectively treated. It's been shown to stimulate growth of new blood vessels, increase circulation, reduces inflammation and swelling. It's thought to help strengthen the immune system, stimulates release of stem cells, enhances mitochondrial function, increases the production of superoxide dismutase, increase the ability of the body to fight disease and infection. Vegetables says my friend had, had radiation damage and got HBOT. It worked wonders for her. She had neuropathy so bad from the chemo that she could not hold anything in her hands after it's all but gone. So there's another testimonial there. And I'm glad you shared that with us because we're going to share some other things here as well. So part two, so what are the health benefits of hyperbaric oxygen therapy? Typically, we say, okay, here's the mechanism, what is the health benefits? This is going to be a longer segment. So normally we take a break, 30 minutes into it. I'm going to take a quick break here and we're going to come back and talk about the health benefits because this is really what the nuts and bolts are. And we're going to get into some of those questions. Get your questions ready. as we come back after a short little break, and we're going to talk about the health benefits of hyperbaric oxygen therapy. Okay, so again, what are the health benefits? So to understand the health benefits, I want to look at the biochemical effects. So we alluded to that a little bit in part one. Again, to recap part one, hyperbaric oxygen therapy is simply this: increased pressure, increased oxygen concentration, which allows increased delivery of oxygen to the body's tissue. And so the biochemical effects of hyperbaric oxygen therapy. First of all, there's the hyperoxygenation. Again, 100% oxygen. You're delivering more oxygen. It increases the amount of oxygen carried to the bloodstream. It allows more oxygen to be delivered to the deep tissues. One thing I want to help the audience understand, if you're not a clinical person, there's a concept called ischemia. Ischemia is a situation where you have inadequate blood flow to a tissue bed. It could be the heart, it could be the lower extremities. And that ischemia is lack of oxygen primarily. Now, there are other factors involved. There are other nutrients and things, because when you have ischemia, not only it's really the lack of blood flow delivery. When you have a lack of blood flow delivery, yes, you have a lack of oxygen delivery, but you have a lack of inflammatory cells and the like. So there's a little bit more complex than just lack of oxygen. However, the concept of ischemia, by and large, deals with inadequate oxygen delivery to tissue. And so we have inadequate oxygen delivery with tissue, then you have tissue breakdown, you have dysfunction of cells, dysfunction of tissues, and therefore dysfunction of organs. So somebody who's having chest pain due to coronary disease, it's due to ischemia, that's inadequate oxygen delivery to heart muscle tissue. Similarly, if you have a gangrenous leg or ulcer that's not healing, there's inadequate oxygen delivery because the blood vessels typically are compromised due to plaque buildup or whatever the issue is. So you're not getting oxygen there. So there may be blood flow there, but there's a small percentage of oxygen that's getting to the tissue and small percentage of nutrients. So you have a hypooxygenation situation in many situations where you're dealing with the disease state. So if you think about HBOT's effects, one thing it does is deliver more oxygen, as a hyperoxygenation. So if you look at situations where people are just sort of going about their normal lives, and they may not have ischemia or a gangrenous foot or coronary disease anginal symptoms, but they may not have adequate oxygen delivery to tissues, but it may not be severely impaired enough to where they feel symptoms. So basically, there's an impairment of oxygen delivery to tissues, and so over time they get cellular tissue and organ dysfunction. So if you think of HBOT, you're delivering more oxygen, so it can to some extent reverse to this, theoretically, I should say, it can reverse the situation where you're having inadequate oxygen delivery. It's helping you deliver more oxygen. So that's one thing that I want to kind of point out mechanistically. Helps oxygenate cells and tissue that are at risk of dying. They're quiescent, non-functioning state. Now, we have this quiescent or non-functioning state. Many patients with congestive heart failure, we call it hibernating myocardium, hibernating. So the heart muscle can hibernate because the body is kind of smart. When it's not getting enough oxygen, it will rest itself. So it may, instead of pumping 55% ejection fraction, it may pump at 35 or 25% because it's hibernating. It's preserving its energy because it's not getting enough oxygen, therefore not enough ATP. So if you do something to reverse that process, meaning by getting more oxygen to the tissue, then the heart pumping function can improve. I only give that example to, again, reemphasize a situation where there's hypooxygenation can result in organ dysfunction. And if you can reverse that hyperoxygenation, you can theoretically reverse that organ dysfunction. Anti-inflammation. Many of you have seen some of our other talks, know that inflammation is one of the cornerstones of disease, chronic disease processes. It's a cornerstone of how cells and tissue and, of course, organs deteriorate over time. HBOT downregulates inflammatory pathways. It allows blood vessels to constrict, to decrease the leaking and swelling. Reduction of inflammation and swelling strengthens the immune system and enhances mitochondrial function. And so all of these things, again, improve tissue and organ function. It has an antimicrobial effect. Hyperbaric oxygen therapy improves the immune system by weakening infection-causing bacteria. It increases by its natural antioxidants and free radical scavengers. So again, the oxygen delivery enhances your immune system, increases your ability to fight disease. And in some studies, they've shown it to have a synergistic effect with antibiotics. The antibiotics, of course, having an antimicrobial effect, and the hyperbaric oxygen therapy assisting that. And they probably saw that in the diabetic foot data, because there's a fair amount of data with treating patients with foot ulcers, diabetic foot ulcers, and the like. And many times these individuals have infections, gangrene, that have infections. And so a lot of that data may have come there. Neovascularization, the development of new blood vessels. It stimulates blood vessel growth. Revascularization, again, a lot of times ischemia, as I alluded to earlier, is due to impaired circulation, especially microvascular circulation. So this hyperbaric oxygen, delivering more oxygen to tissues, can enhance blood vessel growth and improve that. So those are some of the other physiological. What about stem cell mobilization? Well, what are stem cells? Stem cells are, predetermined cells, pre-differentiated cells, I should say. So you can mobilize these stem cells and it enhances improved blood vessels. Because stem cells can grow into any type of differentiated cell that you may need. So this may be an underlying mechanism as to why it helps improve blood vessel growth and other tissue repair and development. So if you have tissue that's degenerating, if you're mobilizing more stem cells, it allows for tissue repair and tissue recovery more. Now, we alluded to mitochondrial function. It is known to have a direct support on mitochondria. And mitochondria is important because it produces ATP. That's adenosine triphosphate. That's our energy currency of the body. And so it's ATP is stored, and it's a stored form of energy. And so you break off one of those triphosphate bonds, and it creates an energy source. And so when you experience cellular damage, the oxygen capacity is threatened. And so mitochondrial function enhancement is essentially enhancing your body's ability to produce more ATP and enhance the body's ability to increase its energy capabilities. And in my situation, where I'm treating a lot of patients with congestive heart failure, this is important. Improved mitochondrial function improves cardiac function, but it can also improve other function, GI function, because every cell in the body, and therefore every tissue and organ system, needs ATP and needs adequate mitochondrial function. So this is what you have. Even the pancreas could work better if you have diabetes. So what are some conditions that are treated by HBOT? And I looked at the literature. There were not a lot of large studies. There's a lot of small studies. So I didn't really pull any of the studies. But what I did is I put together a list of FDA-approved conditions and non-FDA-approved conditions. And I'm just going to go through the list, and we're going to have like a brief little discussion on, which of these conditions, might we consider treating, and what my limited experiences in using HBOT would help out with dealing with. And I'm going to address that question that Janelle Williams asked earlier in just a minute. So FDA-approved condition includes air gas embolism, carbon monoxide poisoning. And this is the example I alluded to earlier when a patient was in the fire. You typically have carbon monoxide poisoning. And so, and especially individuals with carbon monoxide poisoning, especially have some transient neurological or cardiovascular symptoms. So like, let's say you're in the fire and, you get rescued out and, you're dizzy, or maybe you pass out, you're delirious, or maybe you have chest discomfort or something. Those are neurological or cardiovascular symptoms. And so those are individuals who have a really strong indication for hyperbaric oxygen therapy, because, transient neurologic and cardiovascular symptoms up front can lead to long-term sequelae of cardiovascular events. Central retinal artery occlusion, chronic refractory osteomyelitis. Again, it's a bone tissue that's infected or inflamed, so you can get oxygen to the bone tissue. Oftentimes, these individuals are on antibiotics, so there's a synergistic effect between the hyperbaric oxygen therapy and the antibiotic therapy. Crush injury or other acute traumatic ischemia. So again, here you have tissue that's damaged, blood vessels are damaged, and just think hyperbaric oxygen therapy improves blood vessel repair and growth. So real neovascularization. You can imagine a crush injury would need that. Mobilization of stem cells. You would need stem cells to be mobilized to repair tissue that's been damaged or destroyed. And so the body that needs to repair itself needs this process to be enhanced. Decompression sickness is one of the earlier indications of hyperbaric oxygen therapy. Diabetic lower extremity wounds is one of the common use for hyperbaric oxygen therapy. Failed skin grafts and flaps, gas gangrene, and I imagine dry gangrene may also be beneficial. Necrotizing soft tissue infections. And again, we talked about some of the mechanisms of how hyperbaric oxygen therapy works: antimicrobial, pro-vascularization, increasing stem cells. So you can imagine how all of those mechanisms affect these types of conditions. Radiation tissue damage. I think Vegetables had a friend who had chemo. Vegetables, can you comment on the chat whether your friend had radiation therapy also? Because that may have been part of the problems she was having. Severe anemia. Now, this is one, when I looked at the literature, I wasn't aware of, but it's been some data. I don't think there's a lot, but enough for the FDA to approve it for individuals with severe anemia. Now, I can imagine that if you have severe anemia, you have a poor oxygen carrying capacity. So it's going to affect, the side effects or adverse effects of being anemic. And again, it can help the anemia itself. And probably the mobilization of stem cells from the bone marrow is probably going to help with the stimulation of red blood cell production as well, or may be related to that. And so Vegetables said, yes, a friend did have radiation therapy. So, the radiation therapy probably led to some of the damage or contributed to it. So we see here radiation tissue damage is one of those indications. Sudden sensory neural hearing loss, thermal burns that are severe, intracranial abscess, and also there's some use for brain tumors. Now, for a non-FDA approved condition, now these are conditions where there's some data, not enough, and it probably wasn't adequate for the FDA to give it a 510K approval. But these are what we may refer to as off-label uses for hyperbaric oxygen therapy. So, excuse me, anoxic brain injury and arthritis. I saw some data on rheumatoid arthritis, and there was a study showing the benefits in a group of patients with rheumatoid arthritis with hyperbaric oxygen therapy. Cancer is an adjunct therapy. Cerebral palsy, chronic fatigue syndrome, chronic pain and fibromyalgia, complex regional pain syndrome, concussion and traumatic brain injury, and Crohn's disease. Many of these are inflammatory conditions or conditions where you have tissue damage and trauma. Miss B. Washington, how are you doing today? Is it possible to use this treatment in treatment of Alzheimer's, maybe by building some new tissue in the brain? There's some data and using, I'm not aware of any data with Alzheimer's patients with hyperbaric oxygen. I'm aware of anecdotal reports, and there may be some small studies, but no large studies that I was able to find. But there are people who use it with Alzheimer's. There are also people have used it with autism. I saw some small studies of the use of autism, and there are reports that kids do better. So there's a little bit of, it's more anecdotal than large studies. Inflammatory bowel disease, interstitial cystitis, Lyme disease, migraine and headache, multiple sclerosis, spinal cord injuries, sports injury, stroke, surgery preparation, recovery, and ulcerative colitis. So that, I mean, a myriad of off-label use diseases that we have for using hyperbaric oxygen therapy. I'm going to close out my slide presentation because I didn't have any studies to show you. But what I want to do is just kind of close out with some comments. And I want to address some of those questions. Dr. Palmer, do you have any questions or comments regarding hyperbaric oxygen therapy?
You know, the information on hyperbaric treatment for children, just to kind of touch on the kids, just kind of is limited right now to the skin grafts for injury of for healing of those injuries, or radiation therapy healing injuries. So it's kind of just limited to those areas right now. I think there's some information on autism, but it's not a lot of research behind that. But I mean, in theory, you can say that for the children, technically, their blood vessels and everything don't have as much atherosclerosis. I'm not saying it doesn't have any as an adult, so they're still getting oxygen through. Ideally, you know, we keep those blood vessels open and we don't have to do the hyperbaric chambers. But I think probably it's beneficial just in a preventive way, because I'm, you know, I've done it myself more so to see what it feels like and if it's going to do anything. It's one of those things that's kind of hard to tell. I didn't do a lot of them, but it's relaxing. Just to see if it helps with recovery after a sporting event. You know, I think that was one of the 9 FDA approved indications that you listed. So, I mean, I think it would be good probably for everybody, just like if you go to the spa, for example, and you sit in the sauna and you go to a place where you can sit and get some extra oxygen. I think, you know, or you can go and get some vitamin C injections. Those things can be beneficial to the cells, especially in an environment where our body has taken in so many things over the years where we're not getting oxygen like we should. We're probably not even really breathing anymore like we should. We take shallow breaths as opposed to deep breathing. And so doing something like this can be preventative more so than treating too.
Yeah, I think you're right. And so the commentary is Pat Hobbs says reference to helping CRAO. I don't know what CRAO is. My husband there was only 90-minute window in which there was any help.
I can look up and see what that is. I don't know. I'm not familiar with that. CRAO.
Yeah. So anyway, so the question is, are we planning to use it at Montgomery Heart and Wellness? And I've contemplated using. We're definitely going to bring in infrared therapy. I looked at that data sometime, and part of the reason I presented it last week because there's a lot of strong data in cardiovascular disease patients, although we treat patients, you know, who have other conditions, but there's also a lot of, you know, data for infrared therapy. And I guess with infrared therapy, more people have central retinal artery occlusion. Okay, thanks, Pat. So there are a lot of people looked at it in a very careful manner. with hyperbaric oxygen therapy, with the exception of some of the FDA approved areas where there's not a lot of data showing it, and I think the lack of data is probably due to more the lack of looking. I would think that there'd be a lot of negative findings. Let's say, for instance, a patient with heart failure or a patient with peripheral vascular disease without leg wounds and ulcers. With all these mechanisms of improving circulation and light, it'd be interesting to see if you can improve, vascular flow in people with peripheral vascular disease or coronary flow. And so the reduction in inflammation, Yolanda Williams mentioned, cannabis survivor hyperbaric therapy along with cannabis. So again, can it be helpful as an adjunct in a lot of these areas? Can it be helpful as a sole therapy? We don't know, but I think the data is lacking large because, no one has looked. And unfortunately, in my opinion, there's a commercialization of medicine and science overwhelmingly. And so it's, if there's a strong market for something, then it gets looked at primarily for the sake of getting a product or a drug on the market for the purpose of revenue and for the purpose of profits. And if there's something that's over here that can save lives and improve lives, but there's no strong market for it, it doesn't get looked at. And so we're left saying, well, there's no data, so we can't use it. And even some things that are in this area that does have data, it's just overlooked because, everything on the right side is just based on industrial or commercial gain, as opposed to, patient benefit or overall health. And that's the unfortunate thing. And again, that's commentary on my part. But I think when I looked at hyperbaric oxygen therapy, look at the mechanisms of how it works, you would think it'd be something that we would take a closer look at and to get more data on. I don't think that's the case. So any other comments?
Yeah. One of the comments, Vegetables, says, I think it was used or it had been cited in the past being used for cancers. And she mentioned up here that Jamie of American Homestead, if you go up.
That's right. Yeah. She used it for cancer. Yeah. I saw that comment.
Passed.
I
think that's why they kind of pulled it for, citing that as a cause because it's not consistent. So, saying that it can do that because it probably has to go along with some other things that you need to change too, along with the hyperbaric chamber, changing how you're eating and some other things to kind of decrease the free radicals in the body and other inflammatory processes in the body.
Yeah, I agree. And I think looking at it as an adjunct to a lot of these things, I think is very important because when you get to disease that you're looking at cancer or end-stage heart failure or systemic inflammatory conditions that are severe, you're really having to treat patients with multiple modalities because it's not just, we often say, okay, let's try this drug or that drug. And even in the allopathic world, treating heart failure, there's a combination drug you're using, so not even one drug a lot of the time. You have the drugs plus a device. And so even in the natural approach, we should use a combination of things because, the body in total has to be treated. And so I think hyperbaric oxygen therapy is an area that will be of adjunct. And to answer the question, which I haven't answered yet, I do plan to bring it on as a treatment modality. It's probably maybe a few months away, possibly, before the end of 2021. We're going to start infrared therapy pretty soon because we have a number of patients who, really need it and will benefit from it. And I think hyperbaric oxygen therapy will be beneficial too. And we plan to add as an adjunct. And we plan to do some studies. I'm saying, well, hey, what's the deal with the study, but we plan to do some studies. So we also plan to look at that as well. Nicole Jones want to know would you use it for elective surgery? Not off the top. I would start with patients that I think would benefit. Heart failure patients being at the top of the list, we probably use as an adjunct. We've already prescribed it for a number of patients, although we don't have a facility. We prescribed it for a number of patients. One of our patients who was fighting multiple myeloma, and we were treating with intravenous vitamins and other nutrients plus a raw diet. He was doing detoxes. We had, superfood supplements, and he did very well. Now, he did hyperbaric plus a number of other things. So, it was part of a cascade of things that we use. And I think that's the way to go. But you can certainly do a trial where you're doing a cascade of things plus hyperbaric and a cascade of things without hyperbaric, and definitely, see how the two compare. So, Visual, let us know when you get it and add it to my Medicare pay for it. My hubby needs it. Well, I don't think Medicare will pay for the uses that we will have. And one thing I need to point out is that the units that are typically sold outside of the hospital setting are about 1.3 atmospheres. So to the atmosphere, the pressure units like at sea level in Houston, we're at 1 atmosphere. That's 760 millimeters of mercury pressure, barometric pressure. Now, 33, feet below sea level is about 2 atmospheres. So, some of these commercial hospital chambers go up to 6 atmospheres. But in the ones in the spas, like the ones we may have or others that you see outside of the hospital setting, they go to 1.3. So, you can have oxygen being breathed in and then deliver increased pressure, but you don't get as higher pressure. So you may need more treatments, on the outpatient setting, 40, 60 treatments over a period of time to get those, lasting benefits that you get. But I think it is worth doing a study at those lower pressures with patients with chronic illnesses to make a determination as to what effects we're having with this hyperbaric oxygen therapy. So anyway, well, today is a holiday. We're going to have a short show for you tonight, as I said up front, and I hope you got a lot out of this. Dr. Palmer, I'll see you backstage as I close out. Thanks for your input. And again, as I said, there are many other modalities that are used to treat chronic illnesses. And I do think hyperbaric oxygen therapy has some promise to it. We just haven't looked at it close enough. There's data looking at peripheral vascular disease with diabetic foot ulcers and the like. And just the fact that we know that it's effective in that situation tells me that it's going to be effective in other areas, such as heart failure and the systemic inflammatory diseases and all. So we just need to do more studies, look at biomarkers and the like, so that we can determine how best to use hyperbaric oxygen therapy in individuals with chronic diseases or the like. So I hope you enjoyed this. If you did, please, as always, hit the subscribe button and also hit the button to the notification bell. And please, please, please share this information with someone whom I think would benefit from this information and this knowledge. Until next time, keep it fresh, natural, and live.